Today, let's talk about emergent use of ticagrelor during endovascular reperfusion in large atrial occlusions. Given many emerging indications for endovascular interventions in ischemic strokes, a safe and effective adjuvant antiplatelet regime for acute revascularization has become a subject of interest. Ticagrelor is a direct oral P2 white well inhibitor that may achieve rapid platelet suppression than standard oral therapies. Ticagrelor used in revascularization of acute large atrial steno-occlusive disease, describing procedural, post-procedure thrombotic events, major hemorrhages, and other clinical outcomes were reported. Coming to the methods, this was a single center retrospective case series of large steno-occlusive disease requiring endovascular reperfusion with emergent adjuvant. Ticagrelor defined as 30 minutes of the procedure from skin puncture to closure of the arteriotomy. Major outcomes investigated were thromboembolism in the target artery and symptomatic intracranial or extracranial major hemorrhages. Additional analyses were performed with respect to timing of the administration and use of rescue GPIIb or 3A inhibitors, if any. Coming to the results, 73 consecutive patients were identified presenting with severe ischemic stroke of large artery origin. 67% required stent placement, 9.5% angioplasty, and 23% mechanical thrombectomy only. 2 experienced symptomatic instant occlusion and 7 experienced major hemorrhages, including 3 fatal symptomatic intracranial hemorrhages. Among 19 subjects who received pre-treatment with ticagrelor, there were fewer GP2B 3A administration, angioplasty, and stenting without yielding benefit in functional outcome or mortality. GP2B or 3A was administered as rescue therapy in 45 subjects, that is 62%, which was found associated with increased bleeding compared to patients receiving ticagrelor only, in whom no bleeding complications were recorded. To conclude, ticagrelor as an adjuvant antiplatelet therapy in ischemic stroke of large atrial origin requiring emergent revascularization was found. Effectiveness, safety, need for additional rescue treatment, and comparison to other commonly used oral antiplatelets should be investigated in future prospective studies.